All right.
Welcome back to Breakfast Daily on Citi TV. You can hashtag Breakfast Daily. You can send us a WhatsApp message, 0550-585832. That's our WhatsApp line. And just share your thoughts. Maybe you even want to challenge Danny K's predictions for the World Cup. I mean, he's got some bold predictions there.
Yeah,
but
very daring.
Very daring.
Yeah.
But you can join in the conversation on anything we're discussing this morning. We'll take your messages.
Yep. And if you're watching on our streams, the hashtag is Breakfast Daily. All right. Now, we want to go into the communities now and just look at some stories of things that are happening there. This segment really is basically to throw light on many times challenges that are going on in the communities and so forth. Sometimes there are good things that are happening, which of course we want to also throw a light on to give people a sense of sometimes the good things that are actually happening and encourage others to also say, you know what, we want some of this same goodness in our community as well. We will go over to the Volta region where there previously were some challenges in some particular communities. Our colleague Desmond Selassie Ago has brought us a report, and we'll take a look at that report and then we'll come back and get into some conversations.
In some parts of the Volta region of Ghana, the three-wheeled tricycle, popularly known as aboboya or motokin, is the surest way of accessing emergency medical services. In some instances, the people would have to travel long distances on deplorable road to access health care. But with the introduction of the zipline medical delivery services, some of the communities in rural areas are now able to receive quality medical services in time. Sister Jifa processes Gary at Poviaji in the central town district of the Volta region for distribution in some urban communities. She tells Citi News in the past she would have to travel for over an hour to Akachi in the Akachi South Municipality to access quality health care. But the introduction of zipline has reduced the stress.
Oh, you should come at your agua. Let you go fun, not to come and get fun.
Kechande.
Child, no, ye are. Although you are grabbing, I can live by you. Akachi.
This is the Poviaji Chips compound, and this is their motokin ambulance. We serve some rural communities here in Central Tong. Aishana Kwama Ankra is a health practitioner here at the facility. She tells Citi News, healthcare delivery has been a challenge at their post since the breakdown of the tricycle. She, however, says the introduction of zipline medical delivery has positively impacted the work of health professionals in the area.
The health delivery in this area, it's not easy. It's not easy, especially with the network. It's not easy. And even we don't, that was last 3 years, we didn't even have pipe. So sometimes we have to carry water. The nurses, we carry water. We go to the riverbank, carry water on our head, and then we bring it to the facility. We use them for delivery or sometimes for hand washing. So sometimes when delivery comes impromptu, then we have to carry gallons, go and fetch water for the delivery. It is not easy. Or sometimes you get someone to fetch it. When a person fetches, he takes 1 gallon, 150 pesos for 1 gallon. And we don't have that money. So we use our own money and then we fetch the water. Whenever we get a delivery and we have to refer the person to Akachi, that's where we refer. Then we use the tricycle and then
to convey the
person
to labor.
Yes. Ours has been, there is a fault at where we put the petrol, the tank. So there is a fault, that's why it's not in use. The LMD, we request every 3 months. So after they deliver, if you need another drug, you have to wait for the next 3 months before you get it. But when zipline was introduced, things have been very easy. When we are in shortage of drugs or medicine, we just request and within 30 minutes, we get them. But previously, we didn't get any drugs, so we normally refer them to the higher facilities. But since zipline came, now our referral has reduced. And we are feeling comfortable with it, reliable, convenient.
The district health information officer for Central Tong wants the services to be extended to other deprived areas.
So previously, when let's say there's a snake bite in these communities, it will take a very long time for the facility to refer from this area to the regional hospital for the person to be provided with care. But then once zipline came on board, within a very short period of time, within 10 to 15 minutes, an anti-snake is delivered to these facilities that are located in remote areas, and then it is provided to the client who has been bitten by a snake. Where the facility is located, in fact, they actually need it because they have to cross like 2 or 3 rivers before you get to that facility. So our major concern is that they should bring that facility on board for now.
Which facility is it?
Ugaji Chiefs. Yes. So once they bring that facility on board, I think it will be very, very helpful for us. For now, they deliver to a nearby facility.
All right, so that's the report there by our colleague Desmond Ago. Now, that's a really good intervention. You know, I think initially when in my mind goes back to when zipline came to Ghana initially, there was a lot of hue and cry about the value that we would get, and that people, instead of fixing their road, they are going to bring zipline and all that. But the reality is that the cost implication of, if you say fix the road as opposed to zipline, a kilometer of road is over $1 million US. Do you see? Just 1 kilometer. And there are many places, hundreds of kilometers of roads to places that have not yet been built, and even some places where the road, some kind of a path or a way exists. When you look at the way we are behind on our debt repayments and all those kinds of things, and how much road is yet to be constructed, when are we going to get to some of these communities? So for me, I think that the zipline intervention has been one of the maybe best things that could have happened in our health sector, especially to the people that live in remote areas. I think it's one of the best things, because there's so many good stories we've heard of people in other communities, not just in the Volta region, in the East region, in the North, and so on. You call for it, and in a couple of hours later, the drone is dropping it off. I think it's fantastic.
It is. I hope they can scale up and cover more of the country. And even in these urban areas, we could use some of that service, places, like you're saying, any intervention that solves a problem like healthcare service delivery and getting drugs to people who need it, getting blood to people who need it in emergency situations, I think is laudable. And, it's an interesting story as well, because we're told that this was an innovation that came out of some meetings in the US, and Ghana started this. Then the US, they decided to emulate what Ghana did here. Meanwhile, it's a company that was based there. Nobody really took advantage of it. And tried it here. So just to say that, the forethought that was put into establishing it here to provide that kind of service has even been emulated by the country of origin, which is the US, which is kind of a nice note as well. But if we could have more of such companies, it shouldn't just be Zipline. There should be other companies coming up with this, homegrown Ghanaian companies that can still provide that service, so that we have this kind of intervention spread across more parts of the country, reaching people who need it most, and being able to deliver other valuable commodities, life-saving commodities to people. So I think, like you said, it's a good story. It's a feel-good story, right? So kudos to those behind Zipline, and hopefully, as we said, they can scale up and do more.
Well, we want to speak to the country operations lead, Samuel Ekufu. He's the country operations lead for Zipline Ghana. Good morning, sir.
Yes, I can.
Hello, Mr. Ekufu.
Yes, sir. Good morning.
Yes, good morning. Welcome to Breakfast Daily.
Thank you.
All right, so let's just have a good understanding of, before we narrow into the operations at the Enum Medical Center, let's look at your operations across the country. How many communities do you currently serve?
Okay, so good morning. So currently in Ghana, I'd say geographically we are covering about 70% of Ghana now.
Okay.
We are serving about 2,400 health facilities spread across the country. We are located in the eastern region, the Volta region, Oti region, Ashanti region, Western North, and we are serving all these communities from 6 distribution centers. And each distribution center has an 80-kilometer radius. And so from one distribution center, we are able to serve very hard to reach and rural communities across multiple regions. And so there's a chance that from one distribution center we can serve multiple regions where we have facilities that are in very rural communities, mountainous areas, very hard to reach island communities. So in general, I'd say looking at the population of Ghana and the geographical nature of the country, we are currently covering about 70% of the country.
That's pretty impressive. Now, as somebody who is fascinated with drones and gadgets, I'm curious about something. Are you using only fixed-wing aircraft?
Yes. So our drones are not the normal ones that people usually see in videos that are used for taking pictures at events. Our drones look like mini aircraft. And then the wing is just like that of what you see with an aeroplane. But our drones are in a modular design, so you can actually remove the wing and fix it on a different body, and remove the battery from one body and fix it in another body. So we can just remove the parts. So we assemble it quickly while an order is ready to be launched to a hard-to-reach community, and then we quickly launch. So it's not fixed to it permanently. It can always be removed and fixed to another body.
Okay. That's fascinating. So in terms of impact, you're talking about 2,000, in excess of 2,000 different health centers that you're impacting. What is there any way that you have some kind of like a feedback system where you can say that based on your operations or since your operations began, certain health centers had a certain maybe efficiency or the way they function, and since you came on board to start supplying them, there are certain markers that you're looking at that says that they've improved their healthcare capacity by a certain amount. Is there any way you have those kind of figures or data?
So currently, since we started operations in 2019, we've done 278,936 plus deliveries. And in a week, we do averagely 3,000 deliveries across Ghana.
In a week?
In a week, yes.
Wow.
We are doing that across Ghana. And I'd say in terms of impact, our impact truly is seen with respect to the communities that we are serving. We are, we are basically focused on very rural and hard-to-reach areas. And if you look at certain communities in the Volta region, which are very mountainous communities, very hard-to-reach areas, or even there are floodplains where there are communities that have to cross water bodies about 12 times previously because they need to send vaccines across from one point to the other. Now, they don't have to do that because they just have to stay where they are, and then they receive their deliveries right at their doorstep. We've done a number of impact studies across these communities, and in due time would show those details. But definitely there has been some major impact with respect to reducing the time it takes for health workers to spend in terms of going to pick up stocks and bringing it to the facility. That time is reduced, so you have a lot of improved patient health worker time because they don't have to leave the health facilities. There are also a lot of other public health indices that we are also working with our impact team to track, which we'll definitely bring out later. But definitely, I'd say that our impact, particularly in the hard-to-reach communities, has been great. And even looking at some of the other regions as well, like the Western North region, where naturally they have very bad terrain in terms of the road network. We have had a very good relationship with the regional health directorate, and so we've been able to serve them, be a huge support to them with respect to vaccine deliveries. And so impact-wise, we've also been able to do some impact studies in that area to see how the vaccine support that we have provided so far is helping, and the results have been great. As I said, in due time, we'll share the details. But I'd say that since 2019, we've been able to incrementally scale our operations, and we are on a daily serving Ghanaians.
So Samuel, you know, again, kudos to you and your team, but how do you stay afloat financially? Because you serve a lot of deprived areas or rural areas mainly, and we've heard, you know, sometimes there's a struggle with paying for certain, you know, products or things of that nature. So do people pay for the deliveries? Are they able to pay in full? And if not, do you have some kind of funding to support what you do? Talk to us about how Zipline is able to stay afloat and still provide this service to people.
So with respect to how we operate, the health facilities don't have to make any payments to Zipline. And so health facilities are not burdened with the payment of delivery. For medical products, when we send a medical product to a health facility, they are supposed to pay the supplier, which is either the regional medical stores or the National Blood Service if it's a blood product. Right? So the health facilities, once they receive the product, will pay the supplier. They don't have to pay for deliveries. Deliveries that we make to facilities are not paid for by the facilities. The government directly pays Zipline for the services that we are rendering to Ghanaians. Yeah.
All right.
So how does that work? Is it per flight or per month? I mean, how does that?
I don't really have the details. I can't really share a lot of it here.
Okay.
But what I do know is that the government makes payment for the services that we are rendering to Ghanaians, and there's no burden to the health facilities.
I see. All right.
Fantastic. Well, I think it's such a fantastic intervention. You know that, and thanks for keeping the operation going. And I hope that you know in a few years to come we'll still be talking about further expansion and 100% cover and all of that. You know, and so
yes, and you should visit our distribution center as well. It's open for people to come.
Which of them are you inviting us to?
Any of them, wherever you find yourself. If you are in Accra, you can get to Omenako, which is
Omenako in the Eastern region.
Yes, it's not too far from Suhum. You can get there. And see for yourself.
Fantastic. Is that where you are based?
I am, because I'm responsible for all the distribution centers. I rotate a lot. But I'm mostly based in Accra. But I travel across all the distribution centers.
All right. Fantastic. Samuel, thank you very much for speaking to us this morning. All right, we've been speaking with Samuel Ekufu, who is the country operations lead for Zipline Ghana. The numbers are staggering. I'm very impressed, actually, you know, with the amount of work they've done in this short period. It's just about 3 years, just a little bit over 3 years.
Just over 3 years, true.
And done in excess of, getting close to 300,000 deliveries.
That's what he's saying.
Pretty amazing.
Very much, very impressive.
And I can just imagine the number of centers that have such relief, you know, because from what the lady said in the report, if every 3 months is when you can put in your request and expect it to come through every 3 months, then it's like, you know, you need a particular drug now. The last consignment came 2 weeks ago. We're not getting any new things for another 2.5 months. So you got to go somewhere else, right? But now it's just a matter of a request, and then a couple of hours later, it's dropped off, you know, at your facility. You can take care of people.
Technology, man.
It's beautiful. It's beautiful. I guess this is one of those ones that the vice president can pat himself on the back nicely, you know, because I remember the backlash he got, and you know, a lot of, I remember, and I think you can go back and read some of the articles back then when the whole zipline thing came in, you know, but it's a good story, and when Ghanaians in general benefit from an intervention like this, I think that, it's a good thing. Well, we'll take a quick break. Don't go anywhere. Breakfast Daily will continue shortly. There's more stories coming up.